Imagine, you're sitting in a glaringly bright emergency room.
Oh, never a fun place to be.
Right. And the doctor walks in, looks at your chart, and tells you the pain in your abdomen is retroperitoneal.
Which just sounds terrifying.
Exactly. Your brain instantly panics. I mean, you came in expecting clarity, expecting your health to be laid out in plain English, and instead you're hit with this massive, terrifying wall of Latin.
Yeah, it really does feel like an intentional barrier. Like, like you need a classical language degree just to understand what is happening inside your own body.
Totally. We look at a word like retroperitoneal or, antepartum, and we just assume the medical establishment is trying to overcomplicate things.
Hmm.
But, well, what if that intimidating Latin word is actually a highly efficient, incredibly precise GPS coordinate?
And that is kind of the secret of medical terminology. Those massive words are, well, they're usually just tiny interchangeable building blocks that are snapped together. And four of the most critical blocks are the prefixes pre, post, ante, and retro. They are essentially the linguistic markers for before, after, and behind.
So our mission on this deep dive is to show you how mastering this specific handful of prefixes turns thousands of incomprehensible medical terms into like an easily decodable system of time, space, and sequence.
Yeah, we're taking a stack of medical history texts, anatomical guidelines, clinical case studies, and we're going to turn that intimidating wall of Latin into a readable map for you.
But, I mean, to read that map, we have to start with the fundamental rule of this system. It's what the sources call the illusion of simplicity.
Right, because on the surface, you just have two pairs of opposites. I mean, from the Latin, we have pre, which means before, in front of, or prior to, and then post, meaning after, behind, or following.
And then you throw in ante, which also means before or prior to. Like, it basically acts as a formal synonym for pre.
Exactly.
And finally, retro, meaning backward or situated behind. So generally, pre and post mostly map to time, while ante and retro map to position.
But the illusion is thinking that knowing those basic translations is enough. It's not. The absolute golden rule of medical prefixes is that they require an anchor point.
They need context.
Right. They mean absolutely nothing in a vacuum. They encode a relationship, not just a fixed absolute value.
It's like using one of these prefixes without an anchor point is like texting a friend and saying, hey, I'll meet you after.
After what?
Right, after the movie, after next Tuesday. I mean, the prefix is only giving you half of the map coordinate.
That's a perfect analogy.
Yeah.
So let's apply that to the surgery anchor. When you hear the word postoperative, I think the immediate assumption is just, after the surgery.
Sure.
But clinically, that word is totally useless without a specific time frame attached to the anchor. Hospitalists do not just diagnose a generic postoperative fever.
No, they don't.
Right. They diagnose a fever on postoperative day 1, which they call POD1, versus, say, postoperative day 10.
And let's break down why that timeline fundamentally changes the diagnosis. Because simply cutting into the human body triggers this massive inflammatory cascade.
Oh, yeah. It's a huge trauma.
Right. Your immune system floods the area with cytokines to start the healing process, and that chemical reaction, well, it naturally raises your core temperature.
So a fever on POD1 is just your body doing exactly what it's supposed to do.
Exactly.
The prefix post here is just describing an immediate, entirely expected physiological reaction. But let's move that anchor. A fever on POD10 means something completely, entirely different.
Because roughly half of surgical site infections happen in that 4 to 10 day postoperative window.
Exactly. By day 10, the initial surgical inflammation is completely subsided. So a fever now. That means bacteria have had enough time to bypass the skin barrier, establish a colony, and trigger a systemic infection.
Wow.
Yeah, so the prefix post is doing totally different diagnostic work simply based on its distance from the anchor point.
The anchor dictates the reality of the patient. And we see this play out with incredibly high stakes in our second example, which is the birth anchor.
This is a great one.
Obstetrics uses a triad of terms that beautifully illustrates this whole system. You have antepartum, intrapartum, and postpartum.
And the anchor dividing them is the active phase of labor and delivery. So antepartum care covers the entire physiological marathon of the pregnancy prior to labor.
So that's like the fetal ultrasounds, the maternal glucose tests, monitoring the placenta, all of that.
Right. Then the middle sibling steps in, which is intra. Intrapartum refers strictly to the hours of labor and delivery itself.
And then postpartum covers the delivery of the placenta through the next 6 weeks of recovery, which clinicians, increasingly call the 4th trimester.
Yeah, and the stakes for nailing these anchor points accurately are literally life and death. Just consider postpartum hemorrhage. The American College of Obstetricians and Gynecologists defines this very specifically as blood loss exceeding 1,000 milliliters after the delivery process is complete.
Which is a lot. I mean, losing a full liter of blood is a catastrophic shock to the circulatory system.
It's massive.
Your blood pressure tanks, your organs stop getting oxygen. It remains one of the leading causes of maternal mortality worldwide.
Right. So identifying that specific hemorrhage as postpartum dictates immediate triage protocols in the delivery room. It tells the team that the bleeding is happening because the uterus is failing to contract and clamp down on the blood vessels after the baby is out.
So the prefix instantly communicates the mechanism of the emergency itself.
Exactly.
So we have these highly temporal anchors, right? Surgery and birth are events in time. Pre, post, ante, and retro seem perfectly behaved when they're just tracking hours on a clock. But these prefixes are doing double duty.
They are.
They also act as markers of physical space, and that dual identity is what I think really trips people up.
They definitely blur the lines. Because while pre and post usually stick to tracking time, ante and retro are heavily spatial, like they describe physical geography inside the body. Let's go back to that emergency room scenario you mentioned at the beginning, the retroperitoneal pain.
Right, so to picture this, you kind of have to imagine your abdominal cavity is like a giant inflated balloon. The lining of that balloon is a membrane called the peritoneum.
And inside that balloon, you have organs suspended in fluid, like your stomach and your liver. But not everything fits inside.
No.
Some incredibly vital structures are pushed all the way to the back of the abdominal wall, entirely outside of that balloon.
Yeah, and medical students use this great mnemonic to remember which organs are tucked back there. It's SAD pucker.
I love that one.
Right, so it's suprarenal glands, aorta, duodenum, pancreas, ureters, colon, kidneys, esophagus, rectum. They are retroperitoneal. So retro meaning physically situated behind that peritoneum membrane.
And that spatial distinction is critical because of how human anatomy processes pain. The peritoneum, that balloon lining, is packed with incredibly sensitive nerve endings.
Okay, so if an organ inside the balloon leaks fluid or blood,
The membrane gets severely irritated, and the abdominal muscles will violently contract just to protect the area, causing a really rigid stomach. It is this blazing red alarm that something is horribly wrong.
but what if an organ outside the balloon starts bleeding? Like, say you have a ruptured aortic aneurysm, which is retroperitoneal.
It is terrifyingly silent. The blood is pooling in the back of the body cavity, completely separated from those sensitive nerve endings.
Oh, wow.
Yeah, so the patient might just complain of some vague backache while they're internally losing liters of blood, and their abdomen will feel completely soft and normal to a doctor's touch.
And the bleeding might only reveal itself 24 to 48 hours later as what's called Gray-Turner's sign,
Right.
which is when pooled blood finally seeps through the tissue and appears as like deep bruising along the patient's flank.
Exactly. The prefix retro tells the physician exactly where the danger is hiding from their physical exam. And it performs the same crucial spatial function in a word like retrosternal.
Which means situated physically behind the sternum or, the breastbone.
Right. And that single spatial prefix sits directly at the center of the differential diagnosis between a myocardial infarction, a heart attack, and severe gastroesophageal reflux, which is just heartburn.
Because the esophagus and the heart share the exact same retrosternal real estate. The prefix maps the anatomical danger zone. Okay, wait, I have to stop us here.
Sure.
Because if retro specifically maps physical space, like a kidney physically sitting behind a membrane, why do neurologists talk about retrograde amnesia? I mean, memories don't have physical mass. They don't, take up space in the back of your skull.
That is such a good question, and that is the pivot point of the whole system. This is where retro shifts from describing a fixed position in space to describing a directional movement.
Okay.
The secret is the suffix attached to it, the grade part of retrograde.
Like a letter grade in school.
No, from the Latin gradus, which means to step or walk. Yeah, so when you combine retro and grade, you are no longer describing something sitting behind a wall. You are describing a process stepping backward. So retrograde amnesia is the loss of memory for events stepping backward in time from the moment of a brain injury.
Contrasted with anterograde amnesia, which would be the inability to form new memories stepping forward from the injury.
Exactly. And we can see exactly how this works through, honestly, one of the most famous clinical case studies in neuroscience history, patient HM.
Right, Henry Molaison.
Yes.
So in 1953, to treat his debilitating epilepsy, a surgeon named Dr. William Beecher Scoville performed a bilateral medial temporal lobectomy on him.
Which sounds incredibly intense. So let's translate that using our anatomical GPS. Bilateral means both sides of the brain. Medial means toward the middle. Temporal refers to the lobes near the temples. And lobectomy is the surgical removal of a lobe.
Got it.
So Dr. Scoville essentially suctioned out the seahorse-shaped hippocampus structures on both sides of HM's brain.
And, the seizures stopped, but the neurological fallout was studied for the next 50 years by neuroscientist Brenda Milner. Because removing the hippocampus completely destroyed HM's ability to convert short-term experiences into long-term storage.
Right.
He developed profound anterograde amnesia. The timeline stepping forward was totally bricked. He could meet a doctor, have a conversation, look away for 30 seconds, and have zero recollection of ever meeting them.
It's tragic. But the precision of our prefixes really shines when we look at his past. Because HM could perfectly remember his childhood. He remembered the stock market crash of 1929.
Because those memories were already encoded and stored in other parts of the cortex.
Yes, exactly. However, he suffered a partial retrograde amnesia for the specific window of 1 to 2 years, just stepping backward from the surgery date.
So the memories from that immediate retrograde window hadn't fully consolidated yet when the hippocampus was removed, so they were wiped out too. HM's case is so incredibly complex, researchers needed absolute precision to communicate it to the rest of the world. Which, naturally makes you wonder how the medical field ever agreed on a standardized dictionary in the first place.
Right. Who's in charge?
Yeah. Who sat down and codified this language so a doctor in Tokyo and a doctor in Toronto know exactly what anterograde means?
Well, it definitely wasn't invented in some modern laboratory. This highly technical GPS system was actually inherited from the muddy streets of ancient Rome.
Really?
Yeah. Julius Caesar and Cicero were using these exact prepositions, pre, post, ante, retro, just to talk about like going to the market before or after lunch.
So how on earth did Roman street slang become the bedrock of clinical neuroscience?
Through a massive game of historical telephone that went horribly wrong.
Oh boy.
Yeah. In the 2nd century, you had Galen. He was a Greek physician whose writings became the undisputed Bible of medicine for over a millennium. But Galen couldn't legally dissect humans, so he dissected Barbary macaques and pigs, and he just assumed human anatomy matched.
And then his Greek texts were translated into Arabic during the Islamic Golden Age, and centuries later translated from Arabic into Latin by European monks.
And every time those texts crossed a linguistic border, the vocabulary drifted. The definitions got really mushy. By the Renaissance, medical terminology was just a chaotic, contradictory mess of poorly translated animal anatomy.
Wow. So then a Flemish anatomist named Andreas Vesalius steps in, right? We're talking the mid-1500s. And unlike Galen, Vesalius is actually performing his own human dissections, mapping the body with his own eyes.
Right. And Vesalius realized that observing reality just wasn't enough. He needed an exact language to record it. He couldn't rely on those mushy translated terms anymore.
It's almost like he was the Marie Kondo of Renaissance anatomy.
Yes.
He looks at this centuries-old pile of sloppy medical translations, realizes it is actively harming the study of the human body, and just forces the entire scientific community to throw out what doesn't work and organize the mess into strict, rule-governed Latin.
That is fundamentally what he accomplished with his 1543 masterwork, De Humani Corporis Fabrica. He took the ancient street prepositions and locked them into specific anatomical jobs.
Okay.
So post was assigned to time, retro was assigned to space. He built the very foundation of the modern system.
And his push for organization triggered a centuries-long effort to standardize every single part of the body, which eventually culminated in 1895 with the Basel Nomina Anatomica.
Yeah, the BNA. It was the first truly international agreement on anatomical terms. It stripped away thousands of confusing synonyms and established a single Latin standard, which eventually evolved into the Terminologia Anatomica that we use today.
So Vesalius tried to lock the language down, but language is, slippery, and terminological drift is incredibly stubborn.
Oh, absolutely.
And when words drift in a medical setting, it doesn't just result in a grammar mistake on a chart, it actually dictates surgical interventions. There's this massive debate in gynecology that shows how dangerous this drift can be.
It's a wild story. For a huge chunk of the 20th century, the medical community got incredibly sloppy with how they described the position of the uterus. They carelessly swapped the terms anteversion and anteflexion, as well as retroversion and retroflexion.
So to visualize the difference here, version refers to the entire organ tilting on an axis.
Right.
So anteversion is the whole uterus leaning forward toward the bladder, but flexion refers to the organ folding or bending in on itself. So anteflexion is the top of the uterus bending over like a drooping flower.
And the exact same rules apply to tilting or bending backwards, so retroversion and retroflexion.
Right.
But textbooks started using these fundamentally different structural terms as if they were just interchangeable synonyms. And because the terminology became a tangled mess, a massive harmful misconception took root.
Doctors began to view a retroverted uterus, which is a uterus simply tilted back toward the spine, not as a normal variation, but as a severe pathology.
Yes, they essentially applied a mechanical theory to a biological process. They were visualizing the reproductive system like a set of plumbing pipes.
Oh, no.
Yeah, the assumption was that if the uterus was tilted backwards, sperm physically couldn't swim up the quote-unquote hill against gravity, or the fallopian tubes would be kinked like a garden hose, completely blocking conception.
They genuinely believed the spatial position encoded by the word retro was the direct cause of female infertility and chronic pelvic pain.
Which led to decades of highly invasive, completely unnecessary uterine suspension surgeries.
That is awful.
Surgeons were cutting into abdomens to literally sew ligaments to the abdominal wall, forcefully stringing the uterus forward into an anteposition.
All to correct what we now know is a completely normal anatomical variant. I mean, an estimated 20 to 30% of women naturally have a retroverted uterus, and it has almost zero impact on fertility.
Exactly.
Thousands of women were subjected to surgical trauma simply because the medical community lost control of its own spatial prefixes.
Because words dictate action. And we still see battles over terminology today.
Right.
Just take the ongoing turf war between cardiologists and neurologists over spelling.
Oh, the antegrade versus anterograde debate.
That's the one. Interventional cardiologists and urologists aggressively prefer antegrade without the R.
Right.
They use it to describe normal forward physical flow, like blood flowing down an artery or a catheter pushing forward into a vessel.
Meanwhile, neurologists and psychologists demand the inclusion of their anterograde, specifically to describe memory moving forward in time, like with patient HM.
Yeah, and medical journal editors constantly have to issue usage corrections because physicians keep drifting across specialty lines.
The specialists treat the spelling like protected professional territory, basically. But a missing R is trivial compared to the life or death consequences of mixing up pre and post in modern pharmacology.
Oh, without a doubt.
Because the line between preventing a disease and fighting an active infection comes down entirely to these prefixes.
And we see this most clearly in the treatment protocols for HIV. Modern medicine has given us two miraculous tools: Pre-P, which stands for pre-exposure prophylaxis, and PP, which is post-exposure prophylaxis.
Right. Prophylaxis just means action taken to prevent disease. So PrEP was approved by the FDA in 2012 as a proactive defense. It's a daily oral medication.
Right. You take it before any exposure occurs. It essentially builds a chemical wall inside your immune cells, locking the doors so the virus can't gain entry if it ever shows up.
But PEP is a completely different operational reality. It is a rapid emergency response.
Exactly. If you have been exposed to HIV, maybe through a needle stick in a hospital or sexual contact, the virus enters the bloodstream. But it takes roughly 72 hours for HIV to permanently integrate its genetics into the host's immune cells.
And that 72-hour window is everything.
It is the biological ticking clock. PEP is a 28-day course of intensive antiretroviral drugs that must be started within that 72-hour post-exposure window. It literally chases the virus down inside the body, stopping replication before the virus can establish a permanent reservoir.
And in the early 2010s, public health clinics faced a terrifying communication breakdown. Because the acronyms sound so similar, patients would show up at a clinic within their 72-hour emergency window and confidently ask the front desk for Pre-P.
Yeah, they thought the pre-medication was like the morning after pill.
Right. And the clinicians had to rapidly educate the public because Pre-P requires days to build up effective protective levels in the tissue. Handing an exposed patient Pre-P instead of the heavy-duty PP regimen would mean failing to stop a lifelong HIV infection.
Mixing up Pre-P and P isn't just a typo.
No. Think of it like a house fire. Pre-P is the fire alarm and the sprinkler system you install while the house is perfectly safe.
Right.
PEP is the emergency fire extinguisher you rip off the wall when the kitchen is already filling with smoke. The prefix defines your exact relationship to the disaster.
It really does. And because precision is so crucial, you might assume these rules are applied identically everywhere. But everyday dialects handle these Latin roots surprisingly differently, creating some really persistent misconceptions.
The biggest one is that ante and pre are interchangeable everywhere because they both just mean before.
Functionally, yes. But clinically, geography dictates the usage. In the United States healthcare system, the care a pregnant woman receives is almost universally called prenatal care.
But cross the Atlantic to the UK, and the National Health Service officially uses antenatal. Antenatal classes, antenatal wards.
Why,
It means the exact same thing, but if you use the wrong prefix in the wrong hospital, you instantly mark yourself as an outsider.
and forensic pathology has an even stricter boundary. In death investigations, the medical examiner always refers to injuries sustained before death as antemortem. They never, under any circumstances, write premortem.
There's also a major misconception around the word retro, because we use retro in pop culture to talk about like 80s music or vintage clothes. People naturally assume the medical prefix retro always deals with the past.
Which completely contradicts everything we learned about retro being a spatial marker, like the retroperitoneal kidneys.
Right, so how do we explain a term like a retrospective study? Because a retrospective study explicitly looks backward in time at old patient records to find data.
Exactly.
Yeah.
It seems to completely break the rule.
It doesn't break the rule, though, it borrows it. Retrospective is not an anatomical term, it's an epidemiological one. It uses physical space as a metaphor. The researcher is standing in the present, physically looking behind them at the data trail the patient left.
And we actually borrow these medical prefixes to describe our own data trails in everyday corporate life.
Oh, sure.
I mean, think about how often a tech company has a major server crash or a botched product launch. What is the very next meeting they schedule?
A postmortem.
A postmortem. We literally stole the terminology of a forensic autopsy, examining a corpse after death, to discuss why an app update failed to install.
It's so true. The Latin roots are just deeply embedded in how we process sequence, and we haven't even touched on the neighboring cousins that turn these binaries into incredibly nuanced triads. Oh, right, like intra, meaning within or during. It perfectly splits the difference between pre and post, giving us the intraoperative phase, which is the surgery itself.
Or peri, meaning around. A perioperative care team manages the patient's entire journey, enveloping the pre, intra, and post phases into one continuous safety net.
And we can't forget neo, meaning new.
Ah, yes.
Neonatal specifically defines a newborn infant in their first 28 days of life outside the womb. But people constantly mix this up with postpartum.
Because they sit right next to each other chronologically, but they apply to entirely different human beings.
Exactly.
Neonatal is the baby's timeline. Postpartum is the mother's physiological recovery. Swapping them just confuses the patient charts entirely.
We have covered massive ground on this deep dive. We've seen that medical prefixes are so much more than vocabulary words you just memorize with flashcards. They are coordinates. They're the GPS system of human biology.
They require an anchor point to ground them to reality, and they really blur the lines between physical space and moving time.
And when we lose track of those coordinates, it changes real medical outcomes. It leads to unnecessary surgeries on retroverted uteruses or terrifying mix-ups between an HIV preventative and an emergency cure.
If you step back and look at the whole picture, there is a profound, almost beautiful irony to how we talk about health.
How so?
Well, consider modern medicine. It is arguably the most cutting-edge, high-tech endeavor in human history. We are sequencing individual genomes. We are performing microscopic robotic surgeries while monitoring functional brainwaves in real time. We are manipulating the very code of life.
It is entirely futuristic.
And yet, this entire futuristic enterprise is permanently bolted to the scaffolding of dead languages. We are using the everyday street prepositions of ancient Rome to navigate the microscopic future of the human body.
It is amazing to think that a word Cicero used to order lunch is currently dictating a neurosurgeon's approach to the temporal lobe.
It leaves you with an important question to consider, you know. The next time you are reading a medical report or scanning a surgical discharge summary, look at those massive Latin words. Are we simply trapped by this ancient language, forced to endlessly memorize the grammatical quirks of an empire that fell 2 millennia ago? Or is this rigid, 2,000-year-old Latin scaffolding the only thing strong enough to keep modern high-tech medicine from falling into total chaos?
That is the perfect thought to leave on. Thank you for joining us on this deep dive. Keep asking questions, always look for the anchor points in the information you consume, and keep reading the hidden code of the world around you. We'll catch you next time.